welcome to our first episode of Immunity Matters. I am Annie Shreya, host of the day, and today I am joined by Dr. Sagar Bhattad. He's a pediatric immunologist, rheumatologist, and bone marrow transplant physician. So, Dr. Sagar Bhattad has diagnosed more than 550 patients and also cured many with bone marrow transplant. So, today we will be talking on a very important topic, that is bone marrow transplant for children with low immunity. So I welcome you, Dr. Bhattad.
Hi Annie, thank you. Thank you for having me here.
Yes. So, doctor, could you tell us in simple words, what is this bone marrow transplant?
Yeah, bone marrow transplant I think is an emerging science, and we are able to cure a lot of children these days with the use of a bone marrow transplant. Now, to break it down, I would like to first tell what is bone marrow to simplify it. We all know we have blood cells, the red blood cells, the white blood cells, and the platelets. These cells flow in our blood, isn't it?
Right.
So, the whole question is, where is this blood being produced? Now, that is bone marrow.
Okay.
To simplify, it's the red portion in the center of our bones, where I would simply put it as a factory where these blood cells are being produced. Now, when you use the word transplant, it means you are basically transferring it from, say, one person to another. And when we say bone marrow transplant, that means you are transplanting the bone marrow from one individual to another. So that is what is bone marrow transplant. Now, to put things in perspective, I must say the moment we use the word transplant, people easily understand and recognize liver transplant, kidney transplant, because it is commonly talked about. People are aware that if a kidney fails, you will have to remove the kidney from a healthy person and give it to a person who is having the problem. But when you use the word bone marrow transplant, many people are taken by surprise as to what it is. And I think if one understands that if you can transfer the bone marrow from one person to another, you can cure many blood diseases. So this is what we call the bone marrow transplant. The other terms which people might hear is hematopoietic transplant, hematopoietic stem cell transplant. These are medical terms used for this particular procedure that we do.
Okay. So, which type of children or what kind of children do this transplant is required for?
See, one needs to understand why will we do a bone marrow transplant, isn't it? Now we do a kidney transplant because kidneys are not working.
Mm-hmm.
If somebody's liver fails, you will do a liver transplant. Now, in the very similar fashion, if bone marrow is not working, you can do a bone marrow transplant. Now, imagine if somebody's bone marrow stops working, what would happen? They would not have blood cells in their body. They would not have hemoglobin, so they will need repeated transfusions. One classical example for this condition is thalassemia. Now, in the same way, if somebody's white blood cells are not getting produced. Now, what are white blood cells? These are the cells which fight infections. They are like the army in our body. Now, if some child is born unfortunately with a condition where the white blood cells are not working, that is what we call the primary immune deficiencies. These are immunity problems. Even in those conditions, we can do a bone marrow transplant. So, bone marrow transplant can be done in a variety of conditions. In fact, if you go back historically, bone marrow transplants were first used in cancer patients. Now,
Okay.
why is that? If somebody has got blood cancer, what will you do? You will give them cancer medications called chemotherapy.
Yes.
Now, when you give such medications, they are very strong medicines. The bone marrow will stop working. And
Okay.
in that situation, you can do a bone marrow transplant and
Mm-hmm.
replace it with a healthy bone marrow. So
Okay.
now you understand, in blood diseases, in cancers, in immune deficiencies,
Mm-hmm.
in those disorders where children are not producing blood, for example, thalassemia. So there is a variety of conditions where we can do a bone marrow transplant.
Mm-hmm.
But my focus has been the immune problems. There are children who are born with these genetic conditions and their white cells are not working. And there are n number of conditions. I can name them: severe combined immunodeficiency, SCID,
Mm-hmm.
Wiskott-Aldrich syndrome, and I don't think those names are important. But here the message should be that whenever somebody's immunity is so low that they
Mm-hmm.
are not able to fight infections, we can do a bone marrow transplant.
Okay, great. And where do these healthy stem cells come from, doctor?
Yeah, so see, in bone marrow transplants, you are transplanting the stem cells from one person to another person. That is what I told you, isn't it? So
Yes.
you will need a healthy donor.
Okay.
Now imagine a child is affected,
Mm-hmm.
we can test another person to see
Mm-hmm.
if he or she can become the donor.
Mhm.
And there is something called HLA typing. Now, to make it simple, we all know when we need blood transfusion, what do? We match the blood group. In the
Right.
same way, when we want to do a bone marrow transplant,
Mhm.
we match the donor and the recipient by doing
Yes.
something called HLA typing. And
Okay.
if that is a match,
Mhm.
we can go ahead and choose the donor. Now that donor will become the source of these stem cells. So what we do, we counsel the donor that this is a safe procedure. We
Mhm.
take the cells from the donor. There are ways by which we can take these cells, and
Mhm.
then we give it to the patient.
Okay.
So this is how we can get stem cells from a donor. Now this donor could be a family donor, like a
Mhm.
brother or sister. It could be the father or the mother. And sometimes if we don't get a donor in the family, we go out in registries who
Okay.
offer donors for such condition.
Okay. And how successful has this treatment been?
Yeah, now that's I think that's a big question. How successful?
Yes.
Before answering that question, I think
Mhm.
the first thing we need to understand is why are we doing bone marrow transplant?
Okay.
Imagine there is a child with cancer.
Mhm.
Now, if the cancer does not respond to chemotherapy medicines, and now we are forced to do a bone marrow transplant, or that becomes an indication for a bone marrow transplant, if we don't do a transplant, what will happen to this child? He or she will not survive. In
Okay.
the same way, in children who have very low immunity, for example, a child with severe combined immune deficiency,
Mhm.
they have such low immunity that they will not survive even for a couple of years. So, if I don't do a bone marrow transplant, this child will not see his or her second birthday.
Okay.
Now, that is the problem on one side of
Mhm.
not doing a transplant. Now, when you do a transplant, the outcome can depend on many things. Number one, how is the condition of the child? If a child is too sick at the time of transplant, then the outcomes may not be great. Who is the donor? Have you taken a full match donor, or did you take a half match donor? So several things determine what will be the outcome. But because of advance in medical science and lot of supportive care that we are able to do, good ICU supports, I think our success rates have been somewhere between 70 to 80%. So to a broad majority of children,
Mhm.
at least in immunodeficiencies, we are able to offer a success rate of 70 to 80%. So
Okay.
when parents come to me and ask, okay, I would go ahead with a bone marrow transplant in my child, what is the success? To keep it simple, I say if 10 children undergo transplant, mostly 8 children would become completely okay.
Okay.
And in a couple of them,
Mhm.
despite doing transplant, we may not get good results. But I must say the results are improving day by day.
Okay, great. If I asked you to rate this on the scale of 1 to 10, what would you rate it as?
So I don't think anybody can rate this
Mm-hmm.
procedure. The reason being, this is a life-saving procedure.
Okay,
You're talking of children who may die without this procedure.
right.
So it is whether by doing this procedure you can
Mm-hmm.
save a life.
Okay.
So there cannot be a discussion on terms of rating, but there
Mm-hmm.
can be a discussion in terms of should we offer it to every kid who comes to us,
Right.
or is every child, or does every child who undergo a transplant have a
Mm-hmm.
healthy life?
Mm-hmm.
So I must say majority of children, yes, they do well, but then
Okay.
there are 5 to 10% of children who can have a lot of complications post transplant. And that
Okay.
is why we spend a lot of time with families
Mm-hmm.
talking to them as to what is a transplant, what happens if I don't do a transplant, what happens if I do a transplant. So I
Right.
think that basic information must be available to every family, to
Mm-hmm.
every child who goes for this procedure. Because many a times when children are offered transplants, parents are often confused.
Mm-hmm.
We are talking about big medical terms, but what does it mean to a family? They have simple questions. Will my child get better?
Yes.
That is the most simple question that a parent asks us. And we say yes. We both, parents
Mm-hmm.
and the doctors, are working to get your child better. And bone marrow transplant in such situations where it is indicated can be a life turning situation. It
Okay.
can become a complete cure,
Mm-hmm.
because without this, children are often on medications, they often keep visiting hospitals, they don't lead a normal life. And once you do a transplant, a year down, they have a near normal life.
Okay, great. So, is this a surgical based treat procedure?
Yeah, I think this is a question that we often face when we talk about bone marrow transplant.
Mm-hmm.
Why? Because people often have heard of kidney transplant, liver transplant, and these are surgeries. So, what happens in kidney transplant is that if somebody's kidneys fail, you will have to take kidneys out from one person and give it to the other person, isn't it?
Right.
So you will have a surgery done both for the donor and for the patient. But bone marrow transplant is not a surgery. To
Okay.
make it simple, it is as simple as blood transfusion. So
Okay.
we take stem cells from the donor.
Mhm.
It is in fact taking, like, the blood is taken from the donor and is transfused
Mhm.
as a blood transfusion to the patient. Well,
Okay.
obviously it's not that simple that
Mhm.
you will just admit the patient and give a blood transfusion.
Mhm.
A lot of work happens before and after this
Mhm.
transfusion. So what generally happens, to give you perspective, when I say we will do a bone marrow transplant,
Mhm.
we first find out who is the donor.
Mhm.
Now, once you know who is the donor, you
Mhm.
will have to admit the child in the bone marrow transplant unit, or in the room where
Mhm.
nobody is allowed to enter apart from the child and maybe one parent. So it's a
Okay.
complete isolation,
Mhm.
because that time of the procedure, it is highly risky for the child. Now,
Okay.
what we do once the child is admitted, we give them chemotherapy.
Mhm.
So by giving such medications, the bone marrow of the child stops working. And when the bone marrow stops working, then we take the bone marrow from the donor. It can be taken just like a blood donation. Okay, we
Okay.
call it apheresis.
Mhm.
And then when those cells are taken, they are given to the child as a transfusion. And
Mhm.
once you complete the transfusion, generally after 15 to 20 days, new cells start coming up. And once the new cells start coming up, we say, yes, this is the first step of success. We called it engraftment. So this is broadly a bone marrow transplant. And then the child is discharged and he or she is kept on medications for several months. And generally after a year, if everything goes well, we stop all medications. Now let me tell
Okay.
you,
Mhm.
this is very heartening to hear. We stop all medications. Why? Because if you do a liver transplant or a kidney transplant, often the patients must receive medicines for life, because the organ that has been taken up, it
Mhm.
has to remain in the body. The body
Right.
should not reject it or remove
Exactly.
it, fight it back. But in bone marrow transplant, after a year, we can stop all the medicines. And that is
Okay.
how this procedure is so rewarding
Mhm.
compared to any other procedure.
Okay. And what are the prior preparations must a child take before this bone marrow transplant?
Yeah, see, lot of preparation happens before we take up a child into a bone marrow transplant unit. The first thing is we should confirm the diagnosis. So I think, okay, this child needs a bone marrow transplant. He's got
Mhm.
very low immunity. What is the condition? So we do
Okay.
testing to confirm the diagnosis.
Mhm.
Number two, if the child, say, because of low immunity is having pneumonia, you will not take up that child for a transplant. You will give antibiotics, get
Mhm.
the child better, and build his nutrition. So nutrition is very important. That is the third important thing, that we give them what you say adequate diet. We
Mhm.
consult our nutrition experts, and so build nutrition so that the child is fit to enter into a bone marrow transplant unit. The next thing naturally is to find the donor.
Yes.
Once we find the donor,
Mhm.
that is when we say, yes, the child is now ready, the donor is ready, and now we can go ahead and do a bone marrow
Mhm.
transplant.
So, how long does this recovery take, doctor?
Yeah, so the recovery after bone marrow transplant, I would put it as there are multiple steps. The
Mhm.
first step to recovery, I just explained that, once we give the chemotherapy during transplant, all the cells have stopped getting produced from the bone marrow. So the
Yes.
child is not having any cells being produced.
Mhm.
And after 15 to 20 days, the
Mhm.
new cells start coming up. That is the first step to recovery. We
Mhm.
call it engraftment.
Mhm.
And once the new cells, new blood cells start coming up, the child is discharged. But has the child completely recovered? No. For
Okay.
the next 3 months, the
Mhm.
first 100 days are quite risky.
Mhm.
Here, the immunity is very low. So,
Mhm.
these children during that period stay
Mhm.
very close to hospital.
Mhm.
If there is any fever or any new symptom, they are asked immediately to come back to the hospital, and
Mhm.
we do periodic blood tests and give them medications. So first 100 days is crucial.
Mhm.
Once you cross 100 days, that is step 2 recovery. That means
Mhm.
now the immunity is building up. And generally by 1 year, most often by 1 to 2 year, the whole immunity builds back, and now the child is said to be cured. So I would say this is a long path to recovery. Step 1, 15 to 20 days. Step 2, 100 days. And step 3, somewhere 1 to 2 years.
Okay, great. So, is this procedure painful for the child?
Yeah, this procedure to certain extent is painful, I must admit,
Okay.
because I told you we are going to give chemotherapy.
Mhm.
Now, if a child receives chemotherapy, the child is going to have side effects of the chemotherapy. So for
Okay.
those 15 days, the child because of chemotherapy can have hair fall. They may lose their hairs.
Okay.
They can often develop ulcers in the mouth, and it can
Okay.
become very painful for some children to swallow or to have any solids or liquid food.
Okay.
And because the platelets get reduced, there can be bleeding. And during this period, because your white cells are very low, you can get infections. So this period can be painful. But then there are mechanisms, there are medications, and there is support system to make sure we minimize this pain. For example, we give pain relief medication so that the child does not have much pain. In our hospital, we have some people called play therapists, or we also call them the child psychologists.
Right.
So what do? They every day visit the child and talk to the child and make the atmosphere more playful, so that the child, because the child is isolated all this month within the transplant unit, it is a huge psychological stress on the family and the child. But such play therapists, child psychologists come and support the child and the family. So by medications and by support system, we try to reduce this painful part, so that the child can come out and then lead a normal life.
Okay. So, like you mentioned, certain side effects. Could you tell the important side effects that the parents must know about?
Yeah, so the bone marrow transplant does come with its own problems and complications and side effects. One important problem is that during the time of transplant, because I told you all the cells are very much reduced, they can get infections.
Okay.
So that is one problem. And some infections can become so severe that it could threaten their life. So that is one important problem that we might face. The second problem we might face is in 5% situations, whatever transplant you have done, it fails.
Okay.
You have given the cells, but the body rejects the cells. So it is called graft rejection. That is the second important problem. The third problem could be something called GVHD, graft versus host disease. Whatever cells we have given, they have to help the child, but unfortunately they start attacking the child.
Okay.
So that is called as graft versus host disease, meaning to say whatever cells you have given, they are attacking. These children with graft versus host disease can have rashes on the body, they can have diarrhea, they can have liver problems. But again, there are medications available, and then we can cure these children with these medications. If you talk about the long term, some children, because of the medications that we use, can have problems of infertility, because these medications can affect the gonads, and as they grow older, fertility can be a problem. So these are some of the problems that we may face. But again, I want to reassure people who are watching that these problems are not seen in every child. Most often these problems are mild and can be handled with medications.
Okay. So, what is the treatment given for this GVHD?
Okay, so I think the GVHD itself can be discussed with an hour-long, what you say, a video and a discussion. But to keep it brief, if somebody has got GVHD, one needs to understand it can affect the skin, it can affect your intestines, and it can affect the liver. If it affects the skin, there are rashes. If it affects the intestine, children develop diarrhea, loose motions. And if it affects the liver, then it causes jaundice. Now, the treatment here is basically steroids. So we give corticosteroid medication to control GVHD, and in a proportion of children where these steroids don't work, there are other medications that can be given. For example, something called ruxolitinib, and there are a series of medications that can be given to these patients. Yeah, but one must also understand we do a lot of things to prevent GVHD during transplant. And we can have what you say, another round of discussion as to what we do to prevent GVHD, but maybe that is for another day.
Right.
Yeah.
Okay. How do these doctors find a donor?
So see, to find a donor, first thing is whenever I diagnose a child and I say, okay, your child needs a bone marrow transplant, then the next step is to find a donor. The first thing is to look at the siblings, the brothers or sisters, because there is a good 25% chance that we may get a donor, HLA 10 by 10 match, either in the brother or the sister. So if there are siblings, we do a HLA typing in the siblings. Okay, and here it is important to understand that the siblings must not be affected, because these are genetic conditions. So we do check brother or sister that they themselves don't have the same disease as the child. And once we are sure that they don't have the disease, we do the HLA typing and we find the donor. Now imagine we are not that fortunate, we don't get a donor in one of the siblings. Then we test the parents, the father and the mother. Generally father or mother will be 50% match.
Mm-hmm.
We call it 5 by 10 or the haplo match, right?
Okay.
But occasionally we are lucky to get a full match in one of the parents.
Okay.
Now, if we don't get a match in the parents, then we can look at the registries. There are bone marrow registries in the country. We can ask the registry to check if they have a donor with the same HLA type.
Okay.
If that is available, then we can go for that donor. Now, theoretically, there is a possibility you may not get match anywhere. You
Mm-hmm.
may not get a match in the sibling, you may not get a match in the parent, and there may not be any donor in the registry. So what do we do there? There we can do something called haploidentical transplant. That
Okay.
means father or the mother who is half match can still be used as a donor. And that is because of advance in medical science today, we are able to do haplotransplants.
Okay. So, what is the role of a cord blood in this transplant?
Okay, see, cord blood transplants are slowly going out of fashion. I must say, I
Okay.
have not done a single cord blood transplant, and in India, there are not many centers that these days do cord blood transplant. Now, cord blood is the cord stem cells are the stem cells which are collected from the umbilical
Mm-hmm.
cord at the birth of the baby, right? And these umbilical stump also have stem cells which are kind of preserved, and then they can be used as the source of stem cells for transplant.
Mm-hmm.
But the problem with the cord blood transplants has been that the dose of stem cell is very low. So the time taken to engraftment is
Mm-hmm.
very long. And so most often these days we do not do cord blood transplants.
Okay. So, the most concerned question: how expensive is a bone marrow transplant?
Yeah, I think that's a very important question because expense is always a problem when we talk about transplants. But see, I would put it this way: we have never refused a child for the want of finances when we offer a bone marrow transplant.
Okay.
India is a country where there are enough number of donors and
Mm-hmm.
philanthropists available to support a young child who needs a transplant. The
Okay.
cost of transplant can vary. It can vary from center to center. It can depend on the procedure. It can depend on the donor.
Mm-hmm.
But let me tell you and reassure you, if a child needs transplant, the only thing we ask the child, the family, the parent is, how much would you like to support? And the rest will be taken care by the ecosystem because
Okay.
we have
Mm-hmm.
constant associations with donors and philanthropic organizations
Mm-hmm.
who support these children for transplants.
Okay. And what precocious lifestyle must a child follow after the transplant?
Okay, as I told you before, that following a bone marrow transplant, immunity is not completely okay for several months. So
Okay.
during the first few months, they should follow strict precautions.
Okay.
One is about the food. The
Mm-hmm.
food has to be cooked and clean. We
Okay.
ask them to avoid raw vegetables,
Mm-hmm.
uncleaned, what you say, vegetables. Obviously, they should avoid fruit juices. Everything should be cooked and clean. If they are going to eat, for example, an apple, the apple needs to be cleaned and the peel has to be taken out.
Mm-hmm.
So for such kind of fruits, the peel has to be taken out and the fruits can be taken. The water source has to be clean and boiled.
Okay.
They must avoid contact with a large crowd, going out in public places.
Mm-hmm.
Often when they visit hospital for first few months, they wear a mask.
Okay.
So maintaining a good hygiene is very, very important. They must take shower daily. They
Mm-hmm.
must take their medications regularly. And we often give our hospital cell number where if there is any deviation from what we have told, they give us a call immediately. Because in first few months, first 100 days,
Mm-hmm.
they are strictly told to visit back the hospital if there is any problem or if there is any deviation from the expected course.
Okay. And can this treatment completely cure the child?
Yes, now that is a reassuring part. Bone marrow transplant is curative. For children when it is indicated and
Mm-hmm.
if it is done appropriately and if it becomes successful, it cures them for life.
Mm-hmm.
Meaning to say they are off all medications, they lead a healthy life and they go out in community and perform just like any other person. Yes, it's curative.
Okay. So, in this entire transplant journey, what role would a parent play?
The parent is the center, the pillar of everything, because where do kids look up for any problem? They look up to their parents, they look
Right.
up to their mother and the father. And generally it is not the kid who is stressed out of this situation,
Mm-hmm.
it is the parents who are stressed out.
Mm-hmm.
So how well do they handle this stressful period determines a lot. The parent is not only involved in care,
Mm-hmm.
not only involved in giving medications but giving the social and the emotional support to the kid. And that is where we always request parents when they come to us with these kind of high end procedures, that if they get stressed out, they are supposed to communicate with us, because we again have people who can support young parents, both mother and the father, emotionally, socially, so that, because a lot of time is spent in this procedure, often kids don't go to school for a couple of years. So a lot of socio-economic, socio what you say social dynamics get affected, and parents play a very very important role.
Okay. And could you tell us, is there any particular age limit for this transplant?
No, there is no age limit for this transplant. We have transplanted kids as young as 2 months, and I am a pediatrician, so I don't see adults, but I'm aware that even people of 60, 70 years of age can be offered transplant. Yeah, higher is the age, it comes with its own problems and risks, but age is not generally a bar.
Okay. So, what might happen if the donor is not found, doctor?
No, as I told you before, that today, because of advances in transplants, because we are doing haploidentical transplant, we
Right.
always get a donor. Because even if the father and the mother is not a full match, we can do a half match transplant. So these days, we often get a donor whenever transplant is indicated.
Okay. So, they say precaution is better than cure. So, what precautions must a child take before getting this particular transplant or this related?
So, see, one thing is, before going into transplant, if a child is on medicines, we would always tell them that their medications has to be very regular, and
Okay.
they should avoid getting infections before getting into the transplant unit. They should maintain a good nutrition, so that when you enter the transplant unit, you are in the best state possible.
Mhm. So, what message do you have for the parents having this opinion?
So I would just try to reassure through this video all the parents or anybody watching out, that with advances in medical science, today bone marrow transplant is being offered more often than before to many kids, especially kids with low immunity. Kids with immunodeficiency disorders can be cured with bone marrow transplant, but a good preparation before the transplant, making sure that the child is in his or her best state, whatever problems are there, they are tackled to the best extent before we take the child into the transplant room, helps us get better results. Finances should not be a barrier, and
Okay.
we can cure many children through bone marrow transplants.
Yes, thank you, doctor. Thank you for the beautiful insights that you have given. So, with this, I would like to tell that timely treatment with expert care would be a life saving change for the child. And to all the listeners, please do listen that if there is a suggestion given to you in order to meet a pediatric immunologist, please do consult them. Thank you.